Hi, this is Danielle Kirsh, Senior Editor of Life Sciences at WTWH Media. I'm here to introduce you to the special edition of Medical Design and Outsourcing's magazine, the Women in Medtech issue. It's an inside look at what's going on in the medical device industry, from big medtech executives down to startups and manufacturing executives and founders. The idea behind the magazine every year is to highlight some of the innovations that are happening in the industry that just so happen to be led by women. This year is our 4th year running the magazine, and I have had the opportunity to lead the content of what goes into the magazine each year and have learned a lot of lessons along the way. Women still account for less than a quarter of all executive leadership roles within the biggest medical device companies in the world, and just 21% of the executives in those top 100 companies are women, which is just up 1 percentage point from the year prior. And the number of those in CEO roles remains unchanged at 4. In the magazine, you will be able to find a more in-depth breakdown of the gender disparities in medtech in the Women in Medtech Leadership article, with a graphic that looks at the composition of titles within those executive roles, ranging from human resources to finance positions. In the same spectrum of analyses, you can find an analysis of how much women researchers receive in funding from the world's biggest medtech companies, with a breakdown of the top 20 and how much money they dole out to physicians. This year, we had an impressive lineup of big medtech company executives. Typically, we list 100 names of medtech executives within the industry as a whole, between startups and big OEMs, but this year we decided to list every medtech executive at 100 of the world's largest medtech companies based off of our annual Big 100 that comes out in November. Managing editor Jim Hammerin spoke with Hologic's Chief Financial Officer Carleen Oberton, who led us on to some of the key decisions the women's health company had to make during the COVID-19 pandemic. Jim also spoke with Principal R&D Engineer at TE Connectivity's Advanced Technology Group about how future-minded medtech engineers can find inspiration and innovation. Associate Editor Sean Hooley spoke with Insulet's CEO Shacey Petrovich, who gave us a look at the company's latest iteration of its Omnipod and what more we can expect from the diabetes management company. Our editorial director Tom Salemi hosted Boston Scientific's President of Urology and Pelvic Health on a recent Device Talks podcast, and her expertise in urology was reflected in the magazine. Marissa Fayer, who's the CEO and founder of Her Health EQ, also contributed a piece this year that explained how the COVID-19 pandemic has exposed the healthcare inequities in the U.S. and abroad. We've also included a list of 10 startups that were founded by women or are being led by women, which was sourced from many recommendations across our social media channels and from previous readers of the magazine. You can check out the magazine and more Women in Medtech articles online at medicaldesignandoutsourcing.com under the Leadership tab in the main menu.